Good evening, everybody. I'm going to be joined tonight with Professor Charles Kingsland from Fertility, and we have lots of questions that we are going to answer. And please keep those questions coming in as well, which would be really, really great. So I hope we get through as many as we can, but we will be back on again doing more. So please bear with us. So I'm just waiting for Charles to join me, and then I'm going to start. Here we are, go live with me very quickly, which is brilliant. I'm sure he'll be on any minute now. Charles!
Hi, hello, how are you?
I'm fine, how are you?
Yeah, you've had some traumas, haven't you?
I've had a trauma today, and I thought I had COVID yesterday. I felt really unwell. Did a test, it was negative. Went for a routine dental appointment today and discovered I had an abscess. So I had to have my tooth removed. So my mouth looks a bit funny. I haven't been drinking. I've just got a numb, frozen mouth.
Oh gosh, we've had plenty of questions, haven't we?
Oh, we've had loads of questions, which is great. And I've just said to everybody watching, we'll try and get through as many as we can, but we'll be doing this again anyway. So hopefully that will be good.
Yeah, good.
Okay,
Good.
so do you want to start, Charles, or shall I? What would you like to do?
You start. Gosh, I look like a mad professor.
Your hair looks a bit mad.
That's probably because I am a mad professor. Yes, yes, I've just come in from racing back from the clinic, so I look a bit dishevelled. But excuse me anyway, Zita, you can make up for that.
Oh right, okay. Looking dishevelled. Okay.
No, looking your normal, well turned out, glamorous self.
Okay, one of the first questions we've got is about nutrition. Thinking about fertility treatment, but I need to lose weight, and this is so hard for so many women. Charles, trying to lose weight because many can't access an IVF cycle if their BMI is over 30.
Yeah.
So I'm losing weight with care. So obviously this lady is with care, sticking to a low calorie diet. Will this also get me fit for fertility treatment? With my BMI, I put on weight with each cycle. How can I lose weight safely for ICSI? Is there anything I should avoid? And this is difficult, isn't it? Because many women do gain weight when they do IVF, don't they? And they don't know that. And it's the drugs that sometimes can impact on that, isn't it?
That's right, and you know the weight story is just so difficult, and I have an awful lot of sympathy, particularly for girls who are trying to lose weight, because there's no hard and fast rules, apart from the fact that it can be really difficult, and it does matter not only from the point of gaining access to NHS treatment, but also in terms of success rate, because if you can get your body mass down to a reasonable level, then your chance of success go up. You're the expert on this one, Zita, but all I would say is eat well. Don't be taken in by daft fertility diets, exclusively walnuts and avocados. You can't tell me that eating lots of avocados is going to improve your chance of getting pregnant. But if you do eat those sort of foods, then you're probably eating other nutritious foods, which will help you.
I do think, though, with weight, I think there are misconceptions, because just because somebody is overweight doesn't mean to say they're sitting at home eating cakes the whole time. Very often, a lot of these women are fitter than me. They're exercising. They are looking after themselves. They just find it so hard to shift the weight. And with weight as a woman comes body image, comes a lot of emotional factors as well. So they need help on many levels, not just being told to go away and lose weight.
Absolutely. I saw a patient the week before last, and her body mass index was 35, and she said, "Look, I've always been like this. I consider myself to be fit and healthy, and please let me come in and show you my figure." And sure enough, she came in and she was really well proportioned, but she was just heavy. And your sympathy goes out for these sort of girls, because you're absolutely right that it may be a constitution.
Yes, but it's difficult, isn't it?
It's a real tough one. One of the things that I often say to patients is also just be very, very careful what you drink, because they're the you know, they are the hidden calories. And exercise alone will not help you lose weight.
Yeah.
You've got to. It's got to be part of a controlled diet or restriction of calories anyway.
Yeah, but I think a lot of women make the mistake of, you know, on supermarket shelves of going for low calorie or, you know, fat free and diet free and all this sort of thing. And they've got many more substitutes in them. So it's best to avoid that. But another question that's come through, Charles, is on exercise. What are the best and worst exercises for women to do during IVF ICSI treatment? Can you still run when you're trying to conceive and prepare for IVF? I've run most of my life and I'm fit. I walk regularly, at least 30 minutes a day. Should I do more? Well, I mean, I think that if you're used to a certain level of exercise, then you've got to keep doing it. It's absolutely fine. The only time that we sort of suggest you don't do a lot of exercise is when you're going through an IVF cycle, when you're being stimulated. And the reason, that the thought behind that is that many women have many, you know, follicles. And if you're running and you're exercising, it's quite hard on the abdomen, and it takes blood away from the ovaries. And what you want to do is keep as much blood there to grow the eggs.
Exactly. And you need to, you know, exercise is good. It's good for the mind. It's good for the body. That you can actually do too much exercise though. And I use as a rule, there's no hard and fast rules about this. I use as a rule of thumb that there is being too fit. So if you're running more than say 15 miles a week, I think it's worthwhile, the equivalent of 15 miles a week, I think it's worthwhile scaling down. But there's lots of things you can do. As you said, keep the blood pumping, lots of walking, maybe swimming, but you know, exercise such as lifting weights. I noticed there was one. Could I to lift weights? The answer to that is no.
Yeah, I mean, when you think in the run-up to egg retrieval, when you've got a lot of follicles and you're lifting weight, I mean, you could have a torsion, couldn't you?
You could have lots of things. Just imagine your ovaries just before your egg collection have gone from sizes of walnuts to sizes of maybe a large orange or even a melon. And if you're lifting weights, then that, you know, it's only common sense that that's not going to be a benefit. However, if you substitute that for a bit of cardio, go for a, you know, 5-kilometer walk, that's keeping the blood going to your ovaries. It's feeding your ovaries, and that's got to be good. But you know, violent exercise. There was another one about hip classes. No hip classes.
Yeah.
Go for you know, having not during treatment, you know, preparing for fertility, absolutely. But that sort of strenuous impact, quick burst exercise is probably not good for you. And as far
I agree. And this woman that's talked about HIIT exercise has got PCOS, and exercise is very good if you've got PCOS because it helps with insulin resistance. But again, not HIIT classes. You know, I think you just got to be gentle. You've got to be gentle on yourself, really, haven't you?
Absolutely. And then for the boys, you know, in 1685, when Anton van Leeuwenhoek discovered sperm down his microscope, he actually called them animalcules.
Animal what?
Animalcules. They were baby animals.
Oh right. Okay.
And I think that men should treat their sperm as little baby animals. And what would you do? You keep them cool. You keep them with lots of fresh air. You feed them good nutritional diet, but you do not enhance them with protein shakes or protein enhancing medication, certainly not testosterone, because that might be good for your body and good for your body image, but it's poisonous for sperm.
Yeah, but also I think marathons aren't great for men. And, you know, cycling long distances, not all of the time, but just in the lead up to IVF, it takes a hell of a lot of energy, doesn't it? And like you were saying about keeping the sperm cool, it adds heat, and heat is damaging to sperm.
Exactly. And that's why you should, my rule of thumb again, 15 miles a week. If you run more than 15 miles a week, you're probably exercising too much. So just bring it down a bit. The other thing, of course, cycling. I've seen sperm counts drop with, there was a patient who came to see me just after Christmas, and he was cycling 120 miles a week. Now, that is great for his body and great for his fitness, but it ain't good. Just imagine what his little animalcules are doing, being squashed up and down on a hard bicycle seat. Do something else. Go for a good walks. That's good cardio. Keep your testicles cool. Feed them well. Don't feed them poison. And of course, one thing you must always eliminate from your diet: smoking.
Yes.
That's really not the thing to do.
Yeah.
Oh, here's one here. I drink 3-4 liters of water a day. Is that good? Yeah, that's good.
Yeah.
Drinking
Okay, but you can drink
body.
too much water as well. But and it's fine to have a coffee up until ET. Absolutely. My
Yeah.
nutritionist has put me on a keto diet to reduce inflammation due to endometriosis, and in preparation for my ICSI after my first failed cycle in March. Well, keto diet is good. It helps you lose weight, so it is good. But in the lead up to IVF, what I'd be careful about with keto is it makes the body very acidotic, and that's not great for sperm or eggs. So it's fine to do, but change it in the lead up to your IVF. I've got another question here, Charles, that came through my direct messaging. This is about long and short protocols. Which one should I have, and does the protocol affect a woman with a low AMH?
Well, many years ago, when we first discovered, first started doing IVF, we didn't have these medications that stop you ovulating. So we used to stimulate your ovaries and watch them very carefully, because the eggs, if you weren't careful, would ovulate themselves. Then we started introducing a substance called buserelin, which stopped you ovulating, so you could grow the eggs as mature and as big as you like without fear of them popping and losing them. And the only way we could use that medication was what we called a long protocol. So we started from day 21 of the previous cycle, and then we discovered a new medication called GnRH antagonist, which actually enabled you to stop follicles from ovulating, but in a much shorter space of time. And that's what we call the short protocol. It took us a few years to learn how to do it properly, but nowadays the short protocol is probably preferable in most cases than the long protocol, because it's more convenient, it's easier, it's fewer side effects. But if you've got endometriosis, it's either or. I wouldn't have any particular preference over one or the other. And if I were choosing myself or advising you, I would go for the one that is least stressful. And the one that's least stressful, in my opinion, in most cases, is the short protocol.
Okay. That's great. There's a lady here. Any advice for adenomyosis and trying to conceive naturally?
Again, it's a good adenomyosis is where you get growth of the lining of the womb, the endometrium that goes into the muscle of the womb, and that's called adenomyosis. It can cause a lot of pain, it can cause heavy bleeding, and it can also cause implantational problems within the uterus. There are lots of medications that you can try, or your gynecologist can advise you about, or the fertility clinic in which you're going to. But again, it boils down to trying to control your weight, eating a good, healthy diet, and just improving your lifestyle. These I can't emphasize enough how important it is to do these sort of things to improve your general health. Lots of sleep. Sleep is
underestimated.
It's really underestimated. Stress is a fact of everyday life, and it's it's like weight. It's a very difficult thing to deal with, but if you can manage stress, you can't get eradicated. If you can manage it, all the better. But you, Zita, are the master of stress relief. So is there anything that you would advise in terms of general lifestyle to reduce adenomyosis?
I think it's difficult because adenomyosis is a horrible thing to have. Very often heavy periods, harder to get pregnant sometimes, depending on how severe it is. But it's an inflammatory condition, so anything you can do for inflammation, nutritionally, and anti-inflammatory foods, is important. So, taking thick supplements as well, such as vitamin D, omega-3, these all may help. And there's another question here following on about sugar intake. Does it have to be very low? It's good if you can cut out sugar. I mean, women are ruled by their moods, their foods, and their hormones, especially through a cycle. But it's about sort of like, eating as well as you can. The odd bit of sugar isn't going to do you any harm, and the odd chocolate bar isn't going to do you any harm either. The darker the chocolate, the better. Another question here, Charles. Is IVF better than ICSI for success rates?
No, not necessarily. Well, the reason why we do ICSI, intracytoplasmic sperm injection, is when in cases where the male sperm count is particularly poor, and even though we take the eggs out and introduce them to the sperm, we haven't got the confidence that the sperm may swim into the egg. So in cases of where the male sperm count is particularly poor and we haven't been able to improve it, we just take one good swimming sperm or one good looking sperm and inject it straight into the egg. And in those cases, the pregnancy rate is good. But there is no difference in outcomes between ICSI and IVF if the male sperm count is normal. Yeah. So there is no need to start embarking on treatments or tests that are not necessary. And ICSI isn't necessary in the vast majority of cases where the sperm count is normal.
But Charles, isn't CARE doing something with something called Zymop now, or looking at can you tell the lady something about that?
Yeah, well, fortunately, because we're such a big group of clinics, and we've got specialists throughout our 21 clinics who we can call on to advise on particular problems, because each of our doctors, nurses, Zita with nutrition, etc., complementary therapy, we're very fortunate that we can ask advice from our colleagues. And one of the new bits of kit that Dr. Alison Campbell, our scientific director, is introducing is Zymop. Now, this is a very clever little instrument that enables, which sorts sperm out into, excuse me, into good quality and less good quality by asking the sperm. We don't ask them because they wouldn't understand, but putting the sperm in this Zymop, and they swim through a series of obstacles and come out at the end. And it saves them. What we normally do is spin the sperm in a centrifuge and pick out the best ones after they've been spun around. So Alison describes it like picking the sperm without having to put them through some sort of circus ride, and they come out all giddy and dizzy from the centrifuge. So they swim through, and we pick out the best sperm for ICSI, and it's really meeting with some good success. So we're introducing it now very carefully into our clinic. It's called Zymop, Zymot, and if there are cases out there where couples have got some issues with male factor infertility, it may be worth asking your local clinic about using Zymop and whether it's of benefit to you. Okay, but before you embark on these fancy tests and investigations, ask, is it good for me? What are the risks? What are the benefits? How much it costs? And will it be of overall benefit to me? But I look at this particular test now. I don't know whether you've got it in your clinic yet.
Yes, yeah.
It looks really, really promising.
Yeah, no, absolutely. Another question about vitamin D in drops or form or capsule. It doesn't matter as long as you get the vitamin D into your system. That's really important. So question here, Charles, as well. Can I have an embryo put in my womb after ovarian cancer? I lost both of my ovaries and I'm menopausal.
Yes, you can. If you've had ovarian cancer, then and fortunately it sounds as though you've been cured, which is great news, and you have your uterus, that can grow a baby. What you need to do is to see a specialist in your local clinic, consultant gynecologist, who will be able to advise you as to whether your uterus is capable of growing a baby. And in some cases, if the uterus hasn't been damaged by your treatment, by chemo or radiotherapy, if you've had it, then what you can do is to grow or grow an endometrium using estrogen and progesterone to see whether it grows and develops and the blood flow is good. In which case, you can put an embryo in, and it will work beautifully. And I've seen plenty of women with a past history of ovarian cancer who have an intact uterus get pregnant and grow baby. Because of course, in the first 8 weeks of a pregnancy, you can support it with hormones, and then after 8 weeks, the pregnancy supports itself, whether you've got ovaries or whether you haven't. I remember a patient, a few years ago, she was in her early 20s, mid-20s, who had ovarian cancer and was very worried. And she'd had radiotherapy as well, and she was very worried about her pregnancy. She had one go at IVF, had one embryo replaced from eggs that had been frozen before she had her ovarian cancer, and she got pregnant, had a baby within 2 years of having her diagnosis, which was great. So yes, everything is possible.
Okay, there's another question here. Is ICSI better than IVF for egg fertilization?
We've covered that one.
Yeah.
Not necessarily.
Yeah.
There is some contention about ICSI being used routinely in the over 40s, where the outer, in women who are a little bit more mature, sometimes the egg, the outer casing of the egg might be a bit harder, might be more difficult for the egg, for the sperm to penetrate, in which case then ICSI may be of benefit. But again, this is something you need to ask your local clinic, and there will be specialists there who will advise you as to whether IVF or ICSI in the over 40s, in the presence of normal sperm, may be of benefit. Okay,
we've got a question here which contradicts. Care at Woking told me they prefer to do a long protocol, but you know it's difficult. IVF has to be appropriate to you as an individual, doesn't it?
Yeah.
So would there be a reason why they would suggest that?
That's absolutely right, and apologies to my friend and colleague Mr. Riddle, who is a world-renowned expert in IVF. It's the clinic. So in Woking's hands, then a long protocol may be a benefit. Why? Because they have vast experience. That's what they do, and that's what they get the best results. But generally speaking, the results with the short protocol and the long protocol are the same. So, for example, in Chester, the short protocol would be the treatment of choice, because in their hands that might be preferable. But this is the important thing. It needs to be individualized for the patient, and it's a combination of what's best for you, which clinic you're in, and your gynecologist will give you the best advice or your fertility clinic will give you the best advice for you to give you the best chance of achieving a pregnancy.
Yeah, fantastic. What supplements should you take in the lead up to IVF? I'm happy to answer this one.
Oh, you better answer that one, Zita.
Yeah, I'm a great believer in supplements. I don't think it should take away from your diet, but many women, when you're stressed, when you're going through IVF, you are deficient in nutrients, and I don't believe in a balanced diet. I don't think it exists. And like I said earlier, I think that women are ruled by their moods, their foods, and their hormones. So some weeks they're going to eat a lot better than others. So when you're going for IVF, nutrition is really, really key. It lays down the foundations to healthy eggs and healthy sperm. And I think one of the questions that doctors get asked up and down the country is there anything I can do to improve the quality of my eggs? And I know, Charles, we have our differences in this, and they are genetically determined. But I really do believe that the environment in which your eggs are growing are affected by your lifestyle, whether you smoke, whether you drink alcohol, etc. And I think that, you know, IVF isn't a natural process. You know, when you're trying naturally, you're just, you know, ovulating one egg. When you're going for IVF, we want a whole batch of eggs that we can work with. So, you know, your nutritional needs are different. You need extra protein, less carbs, fats are really, really good. So I would suggest a multivitamin and mineral containing folate, not folic acid. Folate is better absorbed. Vitamin D, many people that come to the clinic are on vitamin D, omega-3. And if you're older, there's another question here about a woman in her 40s. I think inositol is a really, really good nutrient to take. It's used a lot for women with PCOS, helping to regulate cycle, but it's very rich in the follicular fluid, and it's thought as well to help with getting a mature egg, because it's not just about getting an egg, it's getting a healthy mature egg. So that's what I would suggest on top of your diet.
And what about men?
Men, yeah, men the same. Not so much with inositol, although man can take inositol, but in preparation. We so many of us, the way we live our lives, well, probably not at the moment with COVID, but you are depleted through medications you're on, through stress, through exercise, etc. So I think it's important. Question here about vitamin D. Vitamin D is said to prevent severe deficiencies. How much do you suggest as a maximum? Well, I think there's every day we hear about vitamin D, don't we? Especially with COVID and the benefits, and it's so important for health. But I think it needs to be, the way we use it at our clinic is we do blood tests. So we'll do it on a couple. So we'll test their vitamin D levels, and then we can ascertain what those levels are. And many are low. And so we can put them on a sliding scale, vitamin D. So they're probably getting quite a high dose, and then we'll taper it down. But just to word of caution here, you should always sort of talk to your doctors if you are taking high doses of anything. And just because it's a natural vitamin doesn't mean to say it's safe. You can overdose on vitamin D and it can be toxic.
Yeah, that's right.
Yeah.
One of the other things you need to be careful of, and this is relatively new research for men, we tend to routinely put men on zinc and vitamin E or for want of something else. But similarly, vitamin E supplementation is an antioxidant. Actually can be toxic in high doses.
Yeah.
You don't need it. You shouldn't take it.
Yeah.
And you're absolutely right. I think the big story over the next few years is going to be vitamin D. So many of us are vitamin D deficient.
I know, and it's the workhorse of the immune system. And I've had an interesting question here. Can supplements prevent miscarriage? And that is the $1 million question, isn't it? Because the studies are sort of like out on it. Some say it can, some say it can't. But pregnancy is like a 1,000-piece puzzle. And as you know, sometimes there's a couple of pieces missing. And it could be something as simple as being iron deficient, anemic, to having sort of recurrent miscarriages where a lot more tests are involved. But the studies that I've seen that have been done on pregnancy, not necessarily miscarriage, show that things like folate are really, really important. Vitamin D is important. And things like you were saying, antioxidants, A, C, and E. So, it's important to look at absolutely everything when you do have a miscarriage. Because it's very easy to sort of try and focus on vitamins and minerals instead of what else is going on in your life as well, and what further tests you might need.
And you should never underestimate how awful a miscarriage can be.
Oh yeah, absolutely.
I have a patient who I saw this morning. She knows who she is, and I said I'd give her a mention. Just look after yourself and take it easy and give yourself time to recover, because that's what you need. There'll be a lot of people well-meaning but misguided people saying, come on, it's not the end of the world, but your brain doesn't see it like that. Your brain thinks I've lost a baby, and you need to grieve, you need time to get over it and look after yourself and do all the things that Zita has told you with the good diet, the vitamins and minerals, and don't
blame yourself. Women are very good at blaming themselves for miscarriage. It was that glass of wine they had, that cup of coffee, and they've got a face going back to work. But in the relationship, if you're a couple, men have suffered as well, and it's very, very hard for both. That's why I was delighted when I read about New Zealand and having leave if you've miscarried, because sometimes you have to go back to work straight away when you're not mentally and emotionally prepared. Another sad one here. I had a stillbirth at 28 weeks. I've been trying for 5 months. Should I do IVF? And grief has a huge impact, you know, so like miscarriage, stillbirth, loss has a huge impact on getting pregnant again. It's very, very, very hard. And in the scheme of things, 5 months is absolutely nothing.
No.
But the only way this woman's going to be happy is by waking up and having a baby, you know, and that's what's difficult. So
my advice is if it's on your mind now, and of course age is an important factor.
Age, yeah, I don't know how old she is.
And we're not sure how old she is, but get some advice. Go to a clinic that's local, who you can trust, and just say, this is my situation, this is the trauma I've been through, what advice would you give me? And I'm sure, you know, certainly the local care clinic would give you the appropriate advice. And you're absolutely right, it might be just a simple test, it might just be some support, you might need some counselling, and never underestimate you know, the importance of counselling in these really, really dark moments, and that might be all you need. Or maybe that there might be a factor where you should be considering some sort of treatment. So if it's bothering you now, and you've written this, you know, you've written in, then seek advice, get some advice about it.
Okay, another question here. This is the $1 million question. How much does stress affect fertility? Tips for emotional resilience? And is reflexology any good? You know, I think I don't see anybody that's not stressed that comes to the clinic. Most women that are going through IVF have some level of stress. And I think it's important to prepare and plan for your IVF cycle, because those women that manage to get their mindsets focused, they do well in terms of not feeling as stressed, and they feel more in control in the preparation leading up to IVF. But I think there's a lot that there's so much that can be done now. You know, there's meditation, there's yoga, there's all sorts of things. If you can get yourself into that mindset through breathing, etc., you are going to reduce those stress hormones, the cortisol and the adrenaline. But I think it's important to look at the big picture in your life and work out what else is going on, because very often when I will say especially to a woman, what else is going on in your life, moving home, we're doing an extension, we're, you know, we've got working really hard, and I think that you've got to focus your energy on what you're doing. So making that time, and you know as well as I do, Charles, you know, when somebody comes through, it's the women that are totally disorganized, they've got too much going on elsewhere, that forget to take their trigger injection, or you know, they don't feel on top of it. So I think, you know, it's important to get the mindset right.
Absolutely. And the number of times that people put, you know, stress has never been shown to adversely affect pregnancy, but it makes you feel bad, and if you make you feel bad, you're less likely to conceive. And the three most important stresses in life are death of a sibling, divorce, moving house. So why would you choose
fourth, trying for a baby?
Oh, trying for a baby. Having a, you know, infertility, and that's a whole subject on itself, is a very stressful time in your life when you want to have a baby and you're having difficulty. Then you superimpose the treatment on it, and then at that time when you're going through fertility problems, you're having fertility treatment, you decide to move house. Well, that's, you know, you can't help deaths in families or divorces to some extent, but you can delay things that are obviously going to stress you and put you into a, you know, a state of mind which may not be helpful. So you're absolutely right, Zita. Try and manage the stress. You never get rid of it.
I think as well, you know, the thing that does women's head in is not having control and having to deal with uncertainty, but you know, you've got to work on what you do have control over. So you have control over the supplements, the nutrients you take in the lead up to IVF, you have control over the exercise you do, and you have control over your mindset through practice. And I think that it's very easy to exercise, Charles, it's easy to eat, but getting that 20 minutes just to calm your mind down is more difficult, and there's a lot that women can do to do that. And you know, I often ask, and I'm sure you do as well, when somebody's been successful at IVF, I will always say, what do you think made the difference this time? What do you think worked for you? And it's the same three things. I worked on my stress, I was less stressed, I was better nutritionally, and I just calmed myself. I felt calmer this time and prepared going through. And preparation is key. I mean, for most women, or most of us in our life, when we've got an event to prepare for, you prepare for it in the weeks leading up, don't you? You know,
Well,
you'd
that's
never
right.
get married on a Saturday and buy your wedding dress on a Friday as a woman. You
Yeah,
might as a
so-
man, but not as a woman. You know, so you've got to prepare.
And it's important when you're choosing a clinic that one of the things about infertility is you're out of control. You can't control the fertility, so you've got to be able to put your faith in a clinic whereby you can exert or have some element of control in what you're doing, because that in itself, you know, you feel as if you feel as though you're in the right place, you're in the locality you need, you think that the family of the fertility clinic is helping you, that enables you to exert some control and empower you into feeling that you are helping yourself, and that can be a great stress reliever. Or
and I think as well, I think it's important, if you are not happy with a service, a nurse, a doctor, or whatever, it's important that you get that out and you have that conversation, because so often women will say, oh, I don't want to say anything because it affects my cycle or the way I'm being treated. And I think it's important to get it off your chest, because if you don't feel confident and you don't feel something's right, you've got to correct that in your cycle.
Yeah, and we want to know. I mean,
Yes.
certainly, we want to know about that. We want to know, you know, what will help you. You know, what will help you feel better. How do you want to exert control? Never ever feel reticent to ask questions. No matter how trivial or daft you think they are, I will guarantee you, I will have heard more trivial and daft questions. And if you feel as though you want to ask them, then they're important to you. And if that's the sort of thing that might just relieve a little bit of stress and make things a little bit more positive, you never know. Those little marginal gains may just help you achieve what you want to achieve.
Yeah. Well, I think we've come to the end of our questions now, Charles.
Okay.
So thank you so much.
Oh, it's a pleasure. Nice to see you, Zita.
Yeah, it's gone very, very quickly. So if anybody wants to book in with Care, Zita West Clinic, please get in contact on our website. The phone numbers and everything are there. I'm going to be back on Thursday with Maureen Kiley talking about hypnotherapy. So please send your questions in. And I will see you, no doubt, soon, Charles.
Will do. I look forward to it. I'm around next week doing an Instagram with Ali Campbell, Dr. Alison Campbell, as our scientific director. So we'll be talking about Zymop and care maps and all those.
And what day? What day is that on?
I'm not sure. I'm not sure. I think
helpful,
it might be
Charles.
Thursday. I think it might be Thursday. Ali will remind me anyway.
Oh,
so we'll look forward to seeing you then.
Okay. Take care. Bye bye, everybody.
Take it easy.
See you Thursday.
Yeah.
Bye bye.